Hello, all. We're just going to jump in and get started, and our presenter will jump in as well. But my name's Kathy McGinnis, and I'm the Director of Workforce Operations for the CPT program. Thank you so much for joining us today. So let's just jump in and get started. Excuse me. Oh, John is here. Hold on just a second. Now you don't have to listen to me.
Good
Can you
afternoon,
see the?
everyone.
Just let me know when you want me to put the slides forward for you.
Okay. So today, guys, what we're going to do is we're going to take questions throughout the presentation instead of holding them until the end. I am sorry, I am a few minutes late. I was getting dental work done, and it didn't go fantastically, which is not good for me. So, uh, but I'm ready to do this. So, welcome everybody. Thank you, Kathy. And then, of course, any questions that you put in the chat, Kathy will be able to answer. But feel free to raise your hand or just speak up and let me know that you have a question during the presentation, and I am happy to answer it. I like doing that as we go along, just so things are talked about when I'm talking about them. So, sound good, everybody?
I'm fine.
All right, sounds great. Okay. So, my name's John Owens, and I am the Support Services Manager at Flips, Finger Lakes Performing Provider Systems. And I am here, myself and Kathy are here, to present on our CPT program, the Career Pathways Training Program, which is absolutely fantastic. We are a WEO, as this first slide says, a workforce investment organization. There are three of them in the state. Us, and then there's one in the Albany area, and then there's one in the New York City area. And in one of the slides later, it talks about which counties are in each region. We'll talk a tiny bit about the waiver later. And next slide, please. Thanks, Kathy. All right. So these are our strategic pillars that we talk about. But what we're going to focus on today is the workforce. So the federal government gave funds and then to the state, to New York State, and then New York State gave us funds to improve the workforce in 13 different titles in New York State, and those will be listed later on a slide later. And so what we are doing here at Flips is we are paying full tuition, scrubs, and books for students to take one of those 13 courses or fields at college, paying the full tuition. And then what the student, the participant agrees to is to work in New York State for 3 years after they graduate. So that is what they agree to for this program. Next slide, please. Okay, so here are the three areas, like I was talking about. We are the third area, the Finger Lakes area. Then there's the North Country, Capital Region, that's Albany, basically, and Central New York, almost all the way to Syracuse. And then the third region is the New York City region, which of course is the biggest, New York City, Long Island, and the Hudson Valley. Next slide, please. All right, here is the explanation for the Careers Pathway Training Program. So, to address the statewide workforce shortages, just like I was talking about before, this program provides tuition and some other education expense payments, and then we also provide support services. So, what happens is, if you guys end up being students of ours in this program, you will each receive a case manager, an educational case manager to help you throughout the process. And you also will get an educational case manager as soon as you start the process to even decide if you want to put in an application with us. And the supports and the case managers will help you every step of the way, which is awesome. So this program targets high demand shortage areas. So it's those 13 titles that I was talking about below, and they're listed below. The ones that are bolded are the ones that we still have um, available. Um, and the ones that are kind of grayed out are the ones that we are not accepting applications for. And so the real key thing to understand is that you have to graduate by the end of the spring semester of 2027 because that's when our funding runs out for this program. So we have to make the last payment to your colleges and institutions in the spring, at the end of the spring of 2027. So that's why nurse practitioner is no longer available, physician assistant, because those titles take longer than, like, you wouldn't be able to start now and finish at the end of spring of 2027. Okay. And then the other thing about the 3-year full commitment, the 3-year full-time commitment of services, the other really good part about that is you have to work at an organization that serves at least 30% Medicaid or 30% uninsured individuals. So not only does this program help fill those work shortages positions, it helps participants go to college, but it also in turn helps the community and helps to serve the most underserved in our communities. So, next slide, please. So, what do CPT program participants receive? So, they receive application enrollment assistance, tuition coverage, educational case management. So, part of the case management is tutoring services. So, when you're in your program, if you need any additional tutoring, like kind of additional to whatever the school provides or whatever you are already receiving on your own, we also help with tutoring services. We help with apprenticeships and mentorships, and we also help when it's time for you all to enter the workforce to fulfill your commitment, 3-year work commitment. We help with all of that as well. Our educational case managers will help with that. We help with resume building. We can help with job interviews. We can do mock interviews with you guys. Um, so it's really cool, all the different services that we can help you with. Other important details, funding is only available to eligible individuals who have not yet started the program that they want to do with us. So, for example, if you've already started your Master's of Social Work at one of our schools, unfortunately, you can't apply to be one of our students if you're already, a few weeks in or a semester in or 2 semesters in. We only accept new students. Like I said earlier, any incoming students must be on track to graduate by the end of the spring semester of 2027. And again, the participants are required to complete the 3-year full-time service commitment. The other thing about that is that you will have 4 years to work 3 years. So, because this service commitment must be completed by 2031. And you can start the service commitment. You can start as early as now if you're graduating now with us. But for you all, you probably wouldn't graduate until at least the spring of 27, no matter what program you started now. So you would have 4 years until 2031 to work the 3 years. And we do that in case you need some sort of certification or license, in case there's maybe a death in the family and you have to take time off, a pregnancy, many different reasons. Next slide, please. Okay. Here are the participant requirements. You must be a United States citizen or an eligible non-citizen. You must meet all the educational training program requirements. So, in other words, if there are prerequisites for the program that you're going to be going into that need to be completed, you have to complete those before you're able to start the program at the school and be and be able to receive our funding. Um, you must be a resident of New York State in one of those 18 counties, or you can be a resident in a bordering state, one of those 5 states, but you have to be employed by a New York State provider to qualify for our program if you live in one of those 5 states. So, for example, you live right on the border probably, and then you work at a facility in New York State, you could possibly be eligible there. And then you also must commit, like we've talked about, to a 3-year full-time employment somewhere, and it can be anywhere in New York State. So it doesn't have to be in the county that you live in. You can move anywhere in New York State and work anywhere in New York State, as long as it is for the title that we paid for your schooling for, and that the organization that you're working at is one of our attested partners. So they have to get attested through us, and what that means is, and through the state, they have to prove that they serve at least 30% Medicaid or uninsured individuals. So some of you may have somewhere that you already work that you want to continue to work at after you graduate with whatever this new degree is. And if they're not one of our attested providers, we can help you get them attested as long as they meet those requirements. Next slide, please. All right. What does the program cover? Those are the things it covers: tuition, program fees, exams, textbooks, scrubs. Supplies is required by the educational training program. We do cover the educational case management, like I talked about. Um, we have many case managers. We have 2 success coaches also at Flips, and the success coaches help with students that are having trouble in school or some academic, not necessarily trouble, but need more assistance with tutoring or with mentorship or with other things. Our success coaches will help with those students as well. These are the things that are not covered by the program: room and board, meals. We don't cover any prerequisites for your programs. We don't cover parking or transportation. We don't cover laptops, background checks, vaccines, fit testing. We don't cover CPR certification or drug testing or any other standalone processes that are not part of the tuition, but even though they may be required for the program or clinical placements. Okay, so program participants, you guys will need to complete the free application for federal student aid, FAFSA and TAP, because what happens is if you get funding from or student aid from FAFSA or TAP, that money is applied first, and then we pay the remainder of the tuition. And so, just like that second bullet says, our funding is to be used only to cover anything that isn't covered by FAFSA and TAP. Next slide, please. Okay, here are the support services that we provide for participants. We provide case management, like I talked about. And a lot of these are actually involved with the case management. In fact, almost all of them are. The pre-training and the academic program readiness. So our case managers will talk to you about what program you might want to get into or you might want to do. We can help with academic and training program support. Enhanced academic support, like we talked about earlier, our success coaches can help with that. And then when it's time for you guys to move into the workforce to do your commitment, we can help with job readiness, placement support, and all of those things around your employment. We also help with language services, and we also help with other things like housing, transportation, um, social determinants of health. Like our program doesn't pay for those things for our participants, but our case managers can help you find the best resources for those things. Next slide, please. All right. Job Speaker is our jobs platform that we have. And it's an online platform. It's available to you guys that will help you build your professional profile and resume. And then what happens is from all of our tested partners, we have all of the jobs filtered into Job Speaker so you can see them all of the postings. We pull them from everywhere, from the organization's website. We pull it from Indeed. We pull it from many, many different places. So all the jobs are in one spot for y'all to look at, check out, apply for. It's really, really cool. So next slide. This is the journey. So what happens is first you submit your interest form, and you do that at healthcareersnow.org/CPT. Kathy can put that in the chat for you guys. That is our website, where you scroll down and you find the button that says interest form and you fill out the interest form with us. Then you're going to get an onboarding invitation email, and then you're going to start doing workflows in our computer system, which is called GoCo. And that's the pre-services. Thank you, Kathy. The pre-services needs assessment. That's when you go through, you submit your acceptance letter because you have to have an acceptance letter from the school to be able to apply with us. And again, your case managers will help you with all of that stuff. They'll help you apply for FAFSA and TAP. And that's kind of the next step. You're going to connect with support. You're going to get an educational case manager. And then eventually you're going to be ready to apply for the program with us. And then once you apply, your application will get assessed by us and it'll either get accepted or denied. And if it's denied, we will provide you with the reasoning why. And it may even be a situation where you just have to do something else or submit something else, and then you'll be accepted. Next slide, please. All right. So this is how many enrolled students we have so far as of March 16th, a couple days ago. Really, really cool stuff. 2,177 enrolled students from those 21 counties. And you see those three counties in PA. That's because those participants worked in one of our counties, right, in New York State, like I talked about earlier, even though they live and they have a permanent address in Pennsylvania. So these are the job titles on the right. Again, the ones on the top are the ones that we're still offering, and the ones on the bottom are closed to new applicants. Um, Johanna, you can ask your question if you'd like, if you feel comfortable.
Can you hear me?
Yeah.
Okay, yeah. So I did the step one and the interest thing, and then I started to get like inundated with all these GoCo emails.
Okay.
And it's one of them I can't even finish because it's asking me to upload the acceptance letter. And I sent an email saying, how can I apply? Like you said, that we can't be accepted until the program has accepted us. We can't already be
Correct.
enrolled. So how do I apply and still be eligible for the program?
So you can still get started with us and get in our GoCo system and get assigned a case manager
See,
while
I
you're
did.
waiting to get your acceptance letter from the school, because you have to
Okay,
apply with the school first. Like that's first. Uh, once you get
so I'm
accepted,
already getting all the GoCo emails. I have like 10 of them,
yeah.
and none of them are connected with any case manager. No one's reached out to me. I've sent emails. They said they can't answer those questions. So how do I reach a case manager if none are reaching out to me?
Yeah, I'll help you. Kathy, could you put my email address in the chat? Johanna, you just email me and I will get you in
Yep.
contact with somebody.
Okay.
All right. And Kathy's going to put my email in the chat. And I'm sorry about that. All right. Here are our participating schools. This, of course, is not all of them. We continue to add schools. Um, I believe we have well over 50. I think that's right, right, Kathy? Um,
Yes.
Awesome. So you have lots of different choices, lots of different opportunities. Now, I will say that this semester and probably next semester will be the last two semesters that you can even get started with us because we won't have any more programs that finish on time. Um, so it is important to get started with us sooner than later. Um, Next slide, please. I think we're near the end. So, if you have any, so that's our website that Kathy put in the chat earlier. I believe you can scan that bar or that QR code, and that'll also bring you to the healthcareersnow.org work.org/CPT. And then that is our email address for general questions. And then what happens is those questions will get forwarded to me or my team or Kathy or her team. And then we will help there. But you guys all have my email address now. You can all email me and I will make sure you get to the right person. All right. So, any questions, comments, concerns? Angelique, Jamie, Tara, or Tara, do any of you have any questions or concerns, comments?
I have a question.
Okay. Oh,
How
hi,
do you do
Shida,
after
Shida. How do I say her name?
Saida?
Hi, Shaida.
Hello.
Hi.
After you get approved to your program, how long does the process for you guys to tell us if we got approved in the program or not?
Oh, very quick. Once you submit your application, you will know within a day or two. Is that correct, Kathy?
Yes. Yep.
Yeah.
A day or
So,
two.
yeah, so you'll
Okay.
know within a day or two if we accept you. But the good news is you're going to already be in contact with the case manager, and they'll be
Mhm.
able to help you too. So, um,
Okay. And then what is there a deadline? Because I know like my program won't be starting until May.
yeah, no, so you need to be in our CPT program and accepted by us before your program starts.
Oh,
So,
okay.
so I know if it doesn't start till May, it might not be too much of an emergency, but you should try to get in there sooner than later. It doesn't hurt um, to get in there sooner than later. You know what I mean?
Okay. Yeah.
And yes, the LPN program, I saw that question. That is still available. Um, I don't know, Kathy, is the LPO? I don't know if it's available in the fall, if that still finishes in time, but I do know for sure that it finishes in time if you start in the spring. So,
And there are some that are starting in May that
yep,
also would
yep,
finish in time.
cool. Okay. Well, thank you all for coming. I will just stick around for a minute or two, just in case any of you are more comfortable chatting one-on-one. And if no one else has any other questions or comments, have a great day. And I hope this is helpful.